What's up, everybody? My name is Pedro, and today we are here to continue our course on acid-base disorders, okay, guys? So before we start, I would like to ask you to subscribe to the channel, leave it a like down below, okay? And so let's continue with our course, okay? Well, today will be a quick one, okay? Let's remember, guys, what we talked about last class about this equation here, okay? Well, it's an equality, okay, about the pH, the bicarb, and the PCO2, okay? There's an equilibrium here, okay? And all the systems in our body, they want to make the pH a constant, okay? Uh, all the systems that are involved in the regulation of the pH, okay? And how we can do it, okay? We need to take a look again at the bicarb and the PCO2, okay? Uh, if the bicarb goes up, okay, the pH will go up. If the PCO2 goes up, pH goes down, okay? Because it's a there's an inverse proportion between these two, okay? And we need to keep that in mind. And if one of these goes up or goes down, for the pH to be a constant, one of these needs to change, okay? And we'll talk about this in this class, okay? So first of all, let's talk about a metabolic acidosis, okay? A situation that we have this. Remember the normal values for bicarb, it's 22 to 26. And if we have a metabolic acidosis, we need to remember that the bicarb will be down, okay? So in order for the pH to become constant, we need the PCO2 to go, sorry. In a metabolic acidosis, if we will have a low, of course, a low bicarb. So in order for the PCO2 to become a constant, the PCO2 needs to go down, okay? And what's the value that the PCO2 needs to hit in order for the pH to become constant, okay? So we'll have what we can call a compensate metabolic acidosis, okay? It's compensated, okay? If the PCO2 cannot compensate this, it will be a non-compensated metabolic acidosis, okay? So we have an equation for this value that is right here. The PCO2 will be equal to 1.5 times the bicarb plus 8, okay? So let's make an example here, okay? If the bicarb is 12, okay, of course this will be a metabolic acidosis because it will be lower than 22, okay? So let's calculate this, okay? So we will have PCO2, it's equal to 1.5 times the bicarb is 12 plus 8, okay? 1.5 times 12 will be 18, okay? Plus 8, so the PCO2 will need to be equal to 26, okay, in order to compensate this lower bicarb here, okay? I think you got it, okay? So let's continue. What if we have a metabolic alkalosis instead, okay? So again we'll have another equation to know the value that the PCO2 will need to hit in order to compensate this high bicarb, okay? So let's do it. Let's make this example. If we have a bicarb of 30, okay? So it will be the PCO2 will be equal to 30 plus 15, it will be 45. This will be the value that for the PCO2, okay? So let's go to all of until now we talked about only about metabolic disorders, okay? About metabolic acidosis and metabolic alkalosis, okay? So what if the problem is in the lungs, okay? A respiratory disturb, okay? First of all, we need to know that the organ that regulates the bicarb is the kidney, okay? And the kidney, different from the lungs, the kidney can't change bicarb values very quickly, okay? The lungs can do it almost instantly by increasing the ventilatory frequency, okay, or the current volume, and this will quickly compensate any disturb, okay. But the kidneys can do that, okay. The kidneys will take a few days actually in order to compensate a respiratory disturb. So acute respiratory disturbs, the kidney won't be able to help in these situations, okay. Just in a respiratory disturb that it's chronic, okay, that onsets with time in the patient. So let's talk about this right now. Okay, remembering the normal value for PCO2, 35 to 45, okay. Like I told you, it takes time, okay, for the kidneys to compensate a respiratory disturb. So if you have a respiratory acidosis, that is actually the main disturb, because I don't think there's a normal situation where you can find a respiratory alkalosis. The person will hyperventilate, needs to hyperventilate a lot to do a respiratory alkalosis, okay? So a respiratory acidosis, it's a more common disturb that we can face in our day-to-day life, okay? Like if the patient have respiratory insufficient, hypercapnic respiratory insufficiency, will face a respiratory acidosis, okay? So if the PCO2 goes up by 4, okay, guys, sorry, I knew there was something wrong in here that I wrote. Okay, for every 10 that the PCO2 goes up, we need to add 4 in the bicarb, okay, to get a compensation. But it will be every 10 above 40, okay, because 40 is the middle point here in the normal values of PCO2, okay. So if we have a PCO2, okay, of 60, we will need our bicarb, okay? If we are 20 points, okay, 20 units above the middle point in the normal value, so we need to add 8 in the bicarb, okay? So the middle point of bicarb, if you can remember, it's 22 to 26, so it will be 24. Okay, so we'll add 8 points here. So the value for bicarb will be 32 in this situation. Okay, guys, this is all for today. Okay, I think you all got it what I meant to pass to you. Okay, so if there's any doubts, feel free to leave it on the comments. I will try to answer every question. Okay, and so sorry for my English, guys, because I'm not used to talk English on a day-to-day basis, and I'm trying to teach you some stuff. Okay, I'm a defensor of the free knowledge on the internet. Okay, and that's all for today. Don't forget to leave a like, okay, and subscribe to the channel. So I'll see you soon in the next class.